Thyroid disease is one of the most common hormone problems that occurs in patients. This video describes the difference between hypothyroidism, when the thyroid level is too low in the bloodstream, and hyperthyroidism.
Thyroid diseases can be divided into three major groups. There is an excessive production of the thyroid hormone, which is called hyperthyroidism. There is decreased production of the thyroid hormone, which is called hypothyroidism. Multiple nodules or generalized swelling of the thyroid gland is called a goiter. Hyperthyroidism means that the thyroid gland is producing excessive thyroid hormone. It causes increased metabolism, which consumes a lot of your energy. It is the main reason why people having hyperthyroidism feel tired. Many people with hyperthyroidism are also nervous and stressed, which makes them even more tired. Hyperthyroidism can be treated. Hyperthyroidism has many symptoms because all of the processes in the body work much faster. Common complaints are feeling warm, shortness of breath during exercise, loss of strength, menstrual problems, weight loss, increased heart rate, diarrhea, and psychological complaints like fear and irritability. These symptoms usually do not all occur at the same time. In some cases, the thyroid gland might also be enlarged. The most common cause of hyperthyroidism is Graves' disease. It is an autoimmune disease where your body produces antibodies to stimulate the thyroid gland, which produces excessive thyroid hormone, more than the requirement for normal functioning of the body. Graves' disease may also cause eye problems. Unlike hyperthyroidism, hypothyroidism means that the thyroid gland produces decreased thyroid hormone, which leads to reduced metabolism. Symptoms of hypothyroidism are feeling tired, feeling cold, heart problems, increased in weight, depressed feelings, hair loss, hoarse and deeper voice, and bowel problems. One of the common causes of hypothyroidism is Hashimoto's disease. In Hashimoto's disease, there is an immune response of the body against the thyroid gland, which causes decreased function of the thyroid. Hypothyroidism can result from treatment of hyperactive thyroid. Thyroid disorders can also be caused by changes in the structure or form of the thyroid. In some cases, the thyroid might be enlarged. Goiter is one of the most common thyroid problems. When you have goiter, the thyroid gland gets enlarged and there is visible swelling in the neck. Goiter has several causes, such as infection, iodine deficiency, benign or malignant disease. A malignant disorder is extremely rare. When you have goiter, there can be a problem in swallowing or breathing. Before treating goiter, the underlying cause must be determined. Thyroid problems can be diagnosed with blood test and sometimes using a thyroid scan or a puncture. Other times, thyroid swelling disappears even without treatment. Hypothyroidism can be treated with thyroid hormone pills. Depending on the cause, hyperthyroidism can be treated with medication to reduce the production of thyroid hormone. Another option is treatment with radioactive iodine to stop the function of thyroid cells. Surgery can also treat hyperthyroidism. Goiter can be treated with surgery or with radioactive iodine. Do you have any symptoms which might indicate thyroid problems? Please consult your general practitioner for advice.
Now remember, when we look at the blood test that we do to see if someone has thyroid disease, there's a blood test called the TSH, and the TSH, or thyroid stimulating hormone, measures the amount of hormone made in the pituitary gland in the brain. The pituitary gland sends a signal to the thyroid, and the thyroid makes the appropriate amount of hormone. So if your TSH is high, that means your thyroid is not making enough hormone. So your TSH is kind of shouting at your thyroid saying, make more thyroid. If the TSH is low, that means your thyroid levels are high, and so the pituitary gland is saying, whoa now, Don't make any more thyroid. That's too much thyroid. So it's a bit of a reverse. And when people get that TSH and they see that it's high or low, sometimes they can be confused. The free T4, now that's actually measuring the amount of thyroid hormone in the bloodstream. So if the free T4 is high, that means the thyroid's making a lot of thyroid. If the free T4 is low, then that means that the thyroid is not making enough thyroid. It's confusing tests, but once you understand what each test is measuring, it's a little easier to understand. That's a Minute for Health.